Parents, it's a pleasure to speak to you on behalf of Toronto Public Health. We appreciate your continued effort to help keep your children safe at school. During this presentation, I would like to focus on the use of face masks, which is one of the protective measures public health promotes to protect you and your family from COVID-19. It's important for you to discuss this measure with your child. If you, as parents, reinforce this message at home, then your child is more able to follow this measure at school, which will ensure the safety of not only your child, but also protect the others within the school community. There are three really important strategies to help protect us from COVID-19 that we'd like to ask you to help communicate to your child or children. There are other preventative strategies, but these are the three that we would really like parents to reinforce to help children understand why they are so effective and why we need to be really diligent about following them. This includes physical distancing, face masks, and hand hygiene. The second strategy has to do with face masks. Masks should always be worn when indoors and outdoors if you cannot physically distance. This picture really accurately helps us understand why face masks are so effective in protecting us. We know that when we wear a mask, it prevents our own droplets from being spread to others. You'll see from the picture, when no one wears a mask, there is a dispersion of respiratory droplets that potentially can have virus in them. Because you can spread the virus days before you develop a symptom, many people could potentially be spreading COVID-19 to others and not even know that they're infected themselves. So, face mask wearing, provided that it's done properly, is a really effective way of protecting everyone. Masks do two things. They protect the wearer because their droplets are being trapped inside of their mask, and the outside of the mask is providing a barrier by trapping droplets from other people. This slide shows you the face masks and coverings that offer the best protection. A face mask or covering should cover your nose, mouth, and chin without gaping. Face shields, masks with exhalation valves, and clear plastic masks are not alternatives to a mask. The most important thing to remember about wearing face masks is that the fit is absolutely critical. The mask is supposed to be a barrier, and it's really important that we not touch it because we are potentially then infecting our hands with droplets that are collecting on the outside of the mask. So if fit is important, what does that mean? It means that the mask needs to cover the nose, mouth, and chin. It means that it has to be comfortable enough and not too tight, yet still be snug so that the wearer is not touching it and adjusting it all the time. If it's too loose and we are having to pull it up, then it's actually providing a potential form of spread, since it means droplets can spread when the mask is loose, and our hands can get contaminated when we touch the outside of it. We know that a 3-layer mask, 2 cloth layers and 1 inner filter layer, provides the best protection. A filter layer can be made from a cut piece of paper towel, coffee filter, or a cloth fabric. Another important reminder is to change your mask when it gets wet or dirty. The instructions that we try to help children understand on the proper wearing and storing of face masks are the following. Before even touching our mask, we need to sanitize our hands, either with soap and water or hand sanitizer, because we're going to have to put our hands near our face, and that means eyes, nose, and mouth in order to put the mask on. So hand sanitization is the first step always. Secondly, we loop the masks around our ears and try not to touch the rest of our face so we have that comfortable fit covering nose, mouth, and chin. It's really important that we don't let the mask dangle below our nose or around our neck when we are not actually wearing it, because that, of course, can spread the virus as well. It's important to be aware of how we take off our mask. Use our index fingers to loop around those straps and gently take it away from our face and put it in the proper container. If we plan to rewear the mask, it has to be put in some sort of breathable container, such as an envelope or a paper bag. We don't want it in a plastic bag where the moisture is retained and could potentially allow the virus, if there is any, to survive even longer. And it's really important that we help our children understand that their masks belong to them. And as much as they might like the color of someone else's mask, they're not to share them with their classmates. As information changes all the time, please keep informed. Our Toronto Public Health website contains a lot of information to help guide you to make safe choices. Information is updated regularly to provide you with the most up-to-date information. The second link will provide you with more specific school-related information to not only keep your family safe, but also our schools safe. Once you are on the website, you can click on the tab Elementary and Secondary Schools and then on Information for Parents. Additionally, if you have any questions, Toronto Public Health has a hotline which is open 7 days a week from 8:30 in the morning until 8 p.m. at night, or you can call Telehealth Ontario, which is open 24 hours a day, 7 days a week. We know there is a lot of information out there and encourage you to get your information from reliable, trusted sources. And finally, parents, I just want to mention once again that you are such an important part of our school community, and we at Toronto Public Health really value the partnership that we have with parents and schools. We understand this isn't easy, but we really believe that if we all do our part, we can get through this together. Thank you so much for your kind attention to this presentation, and we look forward to continuing our support and working with schools within Toronto. Keep well.